Assalamu alaikum. This is Rashid Mahmood, seat number EP 1777012. The main topic of our presentation is bipolar disorders, and my subtopic is bipolar 2 disorder. So, what is bipolar 2 disorder? Bipolar disorder 2 is a major psychiatric disorder in which the person experiences occasional episodes of hypomania. Person with this disorder also experience episodes of extremely low mood, depression. In between these extreme, the person's mood may be normal. Roughly 60 to 70% of the hypomanic episodes in bipolar 2 disorder occur immediately before or after a major depressive episode. Completed suicide usually during major depressive episode is significant risk occurring in 10 to 15% of persons with bipolar 2 disorder. So you can see here bipolar 2 disorder. The green line is of bipolar 2 disorders, which include the episodes of hypomania as well as the episodes of depression, which occur in between 2 weeks. So how common is bipolar disorder? About 1 in every 200 people develops bipolar 2 disorders sometime during his or her life. So, how this disorder is diagnosed? Bipolar 2 disorders can only be diagnosed by a clinical interview. The purpose of this interview is to determine whether the client has experienced specific symptoms of disorders for a sufficiently long period of time, which is about 4 days for hypomania. In addition to conducting the interview, the diagnostician must make sure other physical problems are not present that could produce symptoms similar to those found in bipolar disorder, such as a brain tumor or alcohol or drug abuse. Bipolar 2 disorder cannot be diagnosed with a blood test or an X ray, a CAT scan, or any other laboratory test. So, there are two broad types of symptoms typically experienced by a person with bipolar 2 disorder: hypomanic symptoms and depressive symptoms. The diagnosis of bipolar disorder requires that the person experience a major depressive episode, a period of at least 2 weeks in which symptoms of depression predominant, and hypomania, that is a period of at least 4 days in which hypomanic symptoms have been present to a significant degree. This is no There is no psychosis, and the depression and hypomania does not happen at the same time. If the person has experienced only symptoms of depression but not mania, he or she is given a diagnosis of major depression rather than bipolar disorder. So, what are the symptoms of hypomania? In general, the symptoms of mania involve in excess in behavioral activity, mood state, in particular irritability or positive feeling, and self-esteem and confidence. So first symptoms of hypomania is euphoric or expansive mood. The client's mood is abnormally elevated. For example, he or she is extremely happy or excited. Mean they have euphoria. The person may tend to talk more and with greater enthusiasm or emphasis on certain topics, means expansiveness. So second symptoms is irritability. The client is easily injured or presently irritable, especially when other seems to interfere with his or her plan or goals, however unrealistic they may be. Third symptoms is inflated self-esteem or grandiosity. The client is extremely self-confident and may be unrealistic about his or her abilities. For example, the client may believe he or she is a brilliant artist or inventor, a wealthy person, a shrewd business person, or a healer when he or she had no special competence in these areas. So next, the hypomanial symptoms is decreased need for sleep. Only a few hours of sleep are needed each night, such as less than 4 hours, for the client to feel rested. So, these are the hypomanial symptoms which are most common in bipolar 2 disorder patient. So the next are some symptoms of depression. So the patient of bipolar 2 disorder also develops symptoms of depression. Depressive symptoms reflect the opposite end of the continuum of mood from manic symptoms, with a low mood and behavioral inactivity as a major feature. So depressed mood, first symptoms of depression. Depressed mood is low most of the time, according to the client. For significant others. So next is diminished interest or pleasure. The client has few interest and gets little pleasure from anything, including activities previously found enjoyable. Next one is change in appetite or weight. Loss of appetite and weight when not dieting, or increased appetite and weight gain are evident. So next one is the change in sleep pattern. The client may have difficult falling asleep or staying asleep, or may wake early in the morning and not be able to get back to sleep. Alternatively, the client may sleep excessively, such as over 12 hours per night, spending much of the day in bed. Next one is change in activity level. Decreased activity level is reflected by slowness and lethargy in terms of both the client's behavior and his or her thought process. Alternatively, the client may feel agitated, on edge, and restless. Next one is fatigue or loss of energy. The client experiences fatigue throughout the day, or there is a chronic feeling of loss of energy. Next one is feeling of hopelessness and helplessness. Client may feel they are worthless as people, they there is not hope for improving their lives, or that they are helpless to improve their unhappy situation. Inappropriate guilt. Feeling of guilt may be present about events that the client did not even cause, such as catastrophe, a crime, or an illness. So next one is bipolar 1 disorder versus bipolar 2 disorder. Both are different. Bipolar 1 is characterized by mania, while bipolar 2 is characterized by hypomania. Bipolar 1 can be associated with psychotic symptoms such as delusion and hallucination, while bipolar 2 disorder will never indicate such psychotic symptoms. Bipolar 1 disorder include electroconvulsive therapy is usually used for non responding cause of bipolar 1 disorder. Bipolar 2 disorder can be treated with psychotherapy or cognitive behavioral therapy in addition to prescribed drug. So these are the differences between bipolar 1 and bipolar 2 disorders. Bipolar 1 disorder, at least one manic or mixed episode. You can see here there is mania. The hypomania is not there, while depression is happening in bipolar 1 as well as bipolar 2. Bipolar 2 never had a manic episode. There are not no manic episode in bipolar 2, but bipolar 2 disorder have hypomanic episodes, at least one hypomanic episode, at least one major depressive episode. So these are the differences between bipolar 1 and bipolar 2 disorders. So next one is cause of bipolar 2 disorder. What are the causes of bipolar 2 disorder? No one knows the cause of bipolar 2 disorder. Theories suggest that the illness may be caused by an imbalance in chemicals in the brain, particularly the chemical called norepinephrine. So there is the decrease in the balance of norepinephrine in the brain. So that's why there is the bipolar 2 disorder happening. It is believed that the imbalance is determined by genetic factors. So next topic is treatment. Effective pharmacological treatment are available for bipolar 2 disorder. These medications do not cure the disorder, but they reduce the symptoms and prevent relapses from occurring. Lithium is the most common drug used for bipolar disorder. Carbamazepine, Tagritol, valproic acid, trileptal are also effective medication. Many persons with the disorder can benefit from sportive counseling to learn how to manage the disorder as well as deal with its impact on their lives. Some types of family therapy also can reduce stress and teach family members how to monitor the disorder. Consult mental health professionals such as psychiatrist, psychologist, social worker, or psychiatric nurse about any question you have. Counseling this handout. So these are the treatment option for bipolar 2 bipolar disorder. First is medication, second one is psychotherapy, third one is cognitive behavioral therapy, fourth one is wellness and healthy lifestyle, fifth one is alternative medicine. And these are the options for bipolar 2 disorder treatment. So these are the medications or agent used for the bipolar 2 disorder. You can see here we can use a mood stabilizer such as lithium, dose 300 mg BID or TID. Next one is anticonvulsant, carbamazepine, lama, Trigine, valproate. These are the anticonvulsant used in the bipolar 2 disorder. Antipsychotics, aripiprazole, haloperidol, olanzapine, quart- quetiapine. These are the antipsychotics used in the bipolar 2 disorder, as well as we can use antidepressant fluoxetine 10 to 40 mg daily to cure the or to treat or to prevent the bipolar 2 disorder. Next slide is case study. There is a case study. So there is a person which is diagnosed with bipolar 2 disorder. He has taken fluoxetine from 10 days. The body temperature is some vitals are given. The body temperature is 98.5 degrees centigrade, pulse rate 82, respiration rate 16, and BP is 122 by 78. He is improving day by day by taking of fluoxetine, but still feels down at time. So there is a subject, you can see here case study. Subject state that he is generally doing well. Depressive symptoms have been improved, but he still feels down at time. He is sleeping better, achieving 7 to 8 hours of restful sleep each night. He feels the medication is helping. Somewhat noticeable side effect. He has no suicide plan and has not thought about the suicide since the recent attempt. He has no access to the prescription medication other than the fluoxetine. He believes that the classes he participate in while impatient help him with coping mechanism. He has also coordinated individual counseling with his case manager. So there is object vitals are given the temperature 98.5, pulse rate 82, respiration rate 16, and BP is 122 by 78. Assessment major depressive disorder, recurrent without psychotic feature. So that means the patient have been diagnosed with bipolar 2 disorder. Plan continue fluoxetine as 10 mg dose. If no further improvement in the next week, we will consider increasing dose to 20 mg. Continue outpatient counseling. Follow up 1 week or earlier if any symptoms worsen. So these are the reference, and thank you so much.